1 out of 5 women in India suffer from polycystic ovary syndrome. PCOS affects millions of women of reproductive age in India and is the leading cause of infertility. Hi, I'm Sania Mirza, and I take privilege to welcome Dr. Suparna, a renowned health expert who will offer practical strategies to empower women in managing PCOS complications. Raising awareness about PCOS can greatly benefit women due to the numerous myths and misconceptions surrounding the condition. Doctor, can you enlighten us on how a balanced portion control meal can positively impact a PCOS patient?
Thank you, Sania. Obesity is a part and parcel of polycystic ovary syndrome. So a balanced diet and a energy restricted diet is the important and key issue of management of polycystic ovary syndrome. So patients should have a balanced diet, mainly protein and fruits and nuts based diet. We can say it's a Mediterranean kind of diet, but carbohydrate should be restricted. So because the chance of diabetes is very high in this group of patients, so I always ask my patient to restrict their total energy in the form of restriction of carbohydrate. At the same time, replace your food with protein and fruits and nuts and vegetables. So if they maintain a balanced diet, they should be nutritionally sound. At the same time, it will help them not to gain weight at the same time.
Thanks, doctor. Can you also share how crucial is physical activity in the management of PCOS?
It is a very relevant question, Sania. So always we say to our patient that if they lose at least 5% of their weight, that will also help the polycystic ovary syndrome management, as the main problem is the endocrine disorder, insulin resistance and excess effect of the male hormone or androgen. So if they reduce weight by doing some regular physical activity and restrict their calorie intake, then the imbalance of the hormone becomes more towards normal and insulin resistance is less and the androgen activity will be less. So problem of like hirsutism, acne, that will improve. Menstrual cycle will be regular without taking any other contraceptive pill or hormonal medication. So it is very important for prevention of the metabolic syndrome, that is diabetes, hypertension, lipid disorders, and even it can lead to cancer as well, uterine cancer. So if we want to prevent all this problem, need to control the endocrine balance. And how we do it? By doing a regular physical activity and lose some weight and maintain the weight in a normal that is a normal BMI roughly 25 at least, then they will be healthy like other person.
Thanks, doctor. One more question. What are the important parameters to be regularly monitored in PCOS patients?
Constant monitoring and follow-up of the patient is very important for PCOS management, as there is no complete cure of the problem and it is a lifestyle modification related disease. So patient needs to be monitored by the gynecologist regularly regarding prevention of developing problem like diabetes, alteration of the lipid profile, maintenance of body mass index. There are other problems as well associated. So if they monitor under a doctor, especially the OGTT test or the glucose tolerance test to prevent check the patient is developing diabetes or already diabetic or not, that makes a lot of difference of the management. So I will advise all my patients, please, if you have a period problem, if you have acne, hirsutism, weight problem, please do not hesitate to contact a gynecologist, because it will be a long-term problem. So if we monitor them early detect the problem, early manage it nicely, then other problem like infertility, period problem, cancer problem, diabetes, hypertension, lipid problem, all will be much lesser, and you should have a healthy life. But if it is very late, then already some of the problem developed, and then you need a long term follow up or management of the medical problems.
Doctor, the clear message for all women is that meal, movement and monitoring are pivotal in managing PCOS for the benefit of women and society at large. Thank you, Dr. Suparna, for your valuable insights which can be vital for effective management of PCOS. As an athlete myself, I recognize the importance of lifestyle management for a healthier tomorrow. Together, we can break the stigma, spread awareness, and support each other in this journey towards better health and well-being.